Hi, Ashley. It's good to see you. I wanted to discuss with you my next session and treatment for my client, Sam, who I've told you suffers from social anxiety. So far, we've established in our intake session that he's got a distant relationship with his family where he doesn't feel that he can easily discuss his issues with them. He's also unemployed and finds the prospect of interviews stressful to the point where he avoids applying at all. More concerning, though, is despite having a supportive circle of friends, Sam has stated he started overthinking in social events with them, mostly about his fear of saying the wrong things to offend them, which has led him to mask his true opinions and affects him forming authentic relationships. As for my next session, I want to focus on introducing cognitive behavioral therapy to Sam. By getting him familiarized with treatment principles and gauging his motivation, my goal is to help Sam feel that he can engage with the workload involved with the CBT program by the end of session. The goal for this session was chosen as it aligns with the first session recommendations outlined by the therapeutic manuals and literature on CBT. Low client engagement has been identified as one of the primary reasons for treatment non-responders for CBT due to its intensive workload. By focusing on Sam's motivation to change, I want to prepare him for how intensive CBT can be and to try and frame it as a team effort that we'll undertake together instead. After reviewing our intake interview and the literature on treatments for social anxiety, as well as considering Sam's unique needs, I have decided that cognitive behavioral therapy is the most appropriate treatment. First, CBT stands out for its evidence base, having a large body of research validating its efficacy in reducing social anxiety symptoms, often sustained at post-treatment for up to a year. Due to its robust evidence base, CBT is rich in resources, including studies validating various tools and manuals to assist new therapists such as myself. CBT also has several alternative therapies it can incorporate, such as motivational interviewing or personalized modular treatment that can be integrated into treatment should Samuel, for example, present comorbidity with another disorder or more severe symptoms, conditions which traditional CBT shows a lower efficacy in treating for. Given that CBT is most effective for individuals with mild to moderate levels of social anxiety and without any comorbid diagnoses, criteria that Sam currently meets, it's the ideal choice for our work together. Furthermore, considering Sam's gender, CBT's emphasis on problem solving and active coping aligns with the typically masculine approach to managing stress and anxiety, which has been found in a systematic review. This compatibility suggests that CBT's focus on exposure, homework, and coping strategies might be particularly appealing and effective for Sam. While CBT is a solid choice for treating social anxiety, there are factors we've got to keep an eye on just to make sure it really hits the mark with Sam. First, CBT requires considerable commitment. It's essential we monitor Sam's motivation closely and ensure he remains engaged throughout the entire process, as it can be a lot for some people. I'll aim to gauge his engagement with treatment in our next session. Additionally, having Sam complete the social anxiety session change index at every session and reviewing homework will also help regularly track his anxiety. Boosting engagement by personalizing therapy to Sam is also crucial for getting results, such as using exposure sessions to restructure his avoidant behaviors with his friends. The depth of therapist expertise and the strength of the therapeutic relationship also significantly impacts treatment outcomes. Although I'm relatively new to this, I plan to follow the Managing Social Anxiety Therapist Guide, a CBT approach manual which has been designed for new therapists like myself. It's been well validated in multiple studies, and there has been research in both independent and group therapy trials that have shown robust effects for up to 3 months post-treatment. As we have already gone through the ethical considerations and other expectations of psychotherapy at our intake session, we are ready to delve into introducing CBT in our next session. I will aim for high interactivity between me and Sam for our next session to set the tone for the rest of treatment. Therefore, I have split the session into 3 20-minute increments. The structure not only allows us to cover essential topics, but also gives Sam the opportunity to voice his questions and concerns, ensuring we're moving forward at the same pace. The first segment will focus on introducing CBT theories and principles to Sam. Here, we will review the CBT treatments more deeply as a set of 13 sessions, where earlier sessions are intended to educate him on his social anxiety and analyze his experiences, and that later sessions are for practicing coping skills in exposure situations tailored to those experiences. Most of the emphasis in this section will be put into Sam attending sessions regularly, doing homework, being willing to gradually confront difficult situations, and being open to new ways of looking at the world in order to have the best chance of treatment. It's crucial for Sam to grasp these concepts early on, as they'll form the backbone of our work together. We'll also introduce the client workbook, Managing Social Anxiety Client Workbook, that was created to accompany the therapeutic manual I'll be working from. I'll be drawing most of his homework sheets from this workbook as well. The purpose of this section is to have Sam understand the importance of his participation in therapeutic activities towards achieving outcomes in CBT. For the next session, we will discuss the spectrum of social anxiety, from what is considered normal to the excessive anxiety Sam experiences, to highlight that anxiety occurs on a spectrum. By going through a couple of case studies in the client guide of different presentations of varying levels of anxiety and comparing it to Sam's own experiences, Sam is able to place his feelings of saying the wrong thing or being behind in life on a continuum. At this point, it's crucial to establish collaborative empiricism, which involves myself and Sam working together to establish common goals in treatment, and is one of the primary factors contributing to the success of CBT. Sam should feel comfortable enough to express his own input towards treatment, but I should have enough reign over the session to bring the conversation back to therapy goals when we go off track. By setting a time limit here of 20 minutes, we should ensure that we don't go over time while giving Sam enough time to express his own input. The last 20 minutes of the session will be used to gauge Sam's readiness to change. Many people that come to social anxiety treatment vary in their readiness for change, and it's important to gauge where Sam is at and adapt the content of the session accordingly. If Sam shows a high motivation, I will use this time to review any barriers he has towards changing anxious cognitions. This means discussing more in depth as to what the source of anxiety around others' judgments of him is, and whether his family history of feeling overlooked in favor of his sister has affected him. The remainder of this session is to build a better understanding of Sam's cognitions and behaviors that perpetuate his social anxiety, alongside building a stronger therapeutic alliance. Now, on the other hand, if Sam is more ambivalent about therapy, I'll implement motivational interviewing techniques designed and found to be effective for CBT. Employing this technique involves asking questions designed to explore and resolve ambivalence and open discussion around change. Open-ended questions such as, what are some of the things you like about your current situation? And what are some of the things you don't? And how do you feel about the changes you're considering? Are a start to explore Sam's attitudes towards change. By making sure we spend more session time on Sam articulating the difficulties he's experienced from his social anxiety and encouraging him to form his own reasons to change, I aim to empower Sam towards engaging with the CBT program to avoid becoming demoralized. At the end of this, we will assign homework, which will be to complete 3 worksheets. One, which is to document his physical and symptoms of social anxiety. 2, for his thoughts in anxious situations. And 3, avoidance behaviors related to social anxiety, all provided in the client workbook I have prepared for him, and say our farewells. By continuing the course of this treatment, I'm confident that we will be able to reach Sam's long-term goal of reducing his anxiety around employment and social situations through tailoring treatment for Sam, such as exposure to interview role plays. I will also be tracking his anxiety levels with a social anxiety session change index every session to gauge whether we need to incorporate different therapeutic strategies throughout the course, as recommended by my therapeutic manual. I'm confident that CBT is the most appropriate option for Sam's treatment and look forward to hearing back from you.